Oh, there I am. Hello.
Perfect. Hi.
All this technology, I'd be like trying to get it all together.
Got you. I hear
I,
that.
I hope we're streaming in all streams. It's hard to tell. I'm in the future get a moderator so that I can make sure I'm where I need to be.
Okay. Come on, big God.
Yeah, I'm trying. I'm trying.
Moderator. There you go.
I am trying. Hopefully, people are logged in. If you are, hello, good evening. You know, I I can't tell. I'm trying to see. Maybe if let me see if there's anybody in. Anybody in? Hi, everybody.
Everybody's coming off of that weekend.
Yes. Thank goodness everybody was okay that I know of from the storm. So
Same here. Thank goodness. Speaking of disasters, right? Trauma,
yes,
natural disasters qualify to be a trauma. So
yes,
certainly we hope that everyone is well and leaning on their supports during this time. I know FEMA has been very responsive to those
absolutely.
that may need support.
Let me see here. Okay, that might be why I had to hit the go live there. I was like, something didn't go live, so we're good. We're on Instagram and Facebook now. It's like, what's going on? Okay, trying to get it
I like it.
together.
It's like a ghost audience except for you. I love this. The introvert in me loves this.
Well, we could go ahead and get where is it? 7:59. As you can see, I'm looking down like I can't see. I gotta get my glasses. It is 7:59 going on 8 o'clock. So I'm gonna go ahead and we can get started here. I am with Nairi Williams, who is a licensed professional counselor. And this evening we are going to talk about trauma and PTSD. So first off, I want to say, Nairi, thank you so much for coming on the platform and giving information about trauma and PTSD. But before we do that, can you tell us a little bit about yourself?
Sure, sure. Thank you for having me, first and foremost. So, a little bit about my professional self. I have been in the field of behavioral health, mental health, social services, whatever you want to deem it, because it changes over time, for about 28 years. So, I'm a bit seasoned. But in that seasoning, the good news is that because behavioral health is always evolving and changing, I learn something new all of the time. So I am a licensed professional counselor for the state of Georgia. I have been for 14 years. 11 of those years, I became a certified professional counselor supervisor, which means that I have the ability to be a clinical supervisor for any of the new therapists coming on board. I have a passion for quality control and utilization management because I want the new ones coming on to do it better than us seasoned so that everybody is taken care of in the best way possible. So, through the years, I've had a certification in grief and loss, and most recently, trauma. I'm also what I would go ahead and call a qualified expert in crisis intervention and prevention. Almost 11 years of my career was spent working with individuals who were suicidal or homicidal. So, I do have a passion for all of those areas that I mentioned. So thank you. I do live in South Florida now, and I have for over 2 years. I am a wife. I am a mother of two biological sons and a bonus mother to many sons and daughters, an aunt, a friend, and I lift weights with you. So that's who I am in a nutshell. That is who I am in a nutshell. So thank you very much for having me on such a very sensitive subject matter. And thank you for the mission of Behind the Smiles and turning your pain into purpose. I appreciate the platform for many who are experiencing loss in this day and age. So thank you for allowing God to use you in a very special way.
Thank you. And speaking of, we're talking about trauma and PTSD and everything. So one of the things, at least for myself, I know grief and how it happened, because losing my son by suicide can be also trauma, and dealing with that. But can you tell us a little bit about, or what is considered trauma and PTSD and those triggers and how that happens?
Awesome. So what I'd like to do is use a little PowerPoint if I can. All right, here we go. So again, I said recently I became a certified trauma specialist. So a lot of this information from this PowerPoint comes from the Arizona Trauma Institute. So I just have a quote up here by J.D. Lynn, and it says, "I don't do it just for me. I do it for all the people who will be affected if I don't, the people around me and the generations that follow me who don't deserve to bear the burden of unhealed pain." So when you ask what trauma is, first, I want to recognize that as a clinician, as a social worker, a counselor, it is important that we become the healer, right? And in order to become the healer, I can't expect a client to live a better life than I'm living. We ask ourselves often, are we well regulated, intentional, and deliberate in our daily lives? So, in the vein of being transparent, I can also say that I've experienced a certain level of trauma, expected and unexpected, and a lot of relational trauma. So the work that I ask my clients to do is no different than the work that I have done myself. So oftentimes when I meet with a client, the very first thing I do is I thank them for being so vulnerable and open with me on very sensitive subject. My goal is to empower them. My goal is to gain their trust. And my goal is to let them know that they are courageous and that they are very brave. So that's part of making sure that we take care of individuals with trauma. So trauma defined in a very brief, broad overview, according to the Substance Abuse and Mental Health Services Administration, they say that individual trauma is an event or circumstance resulting in physical harm, emotional harm, and or life-threatening harm. It is defined by the individual experiencing the trauma. So I think that's important to mention because on the outside looking in, oftentimes people that experience trauma or go to counseling are judged. And people that have not walked in those shoes per se, well, why is that so hard? And that's, no big deal. And that's this and that's that. And so we want to be very careful when we are working with individuals in such a very sensitive subject matter that we understand that it's not based on our definition, it is based and defined on the person experiencing the trauma. Okay, so just historically speaking, I like to explain the background of stuff as a supervisor. I think it's important that if I tell you the why of doing something as opposed to just saying get out there and do it, it has a more of an impact. So trauma has been around for a very long time. As the slide says, since the 1800s, trauma has been around. And some of the traumas that we are used to, of course, again, natural disasters. We just spoke on hurricanes and tornadoes and so forth, interpersonal violence, domestic fires, car accidents, rape and sexual assault, physical assault, partner and family battery, torture, war, child abuse, emergency worker exposure. We also have most recently deaths that happen in schools, movie theaters. We have the 911 situation. We have hostage situations. We have driving traumas. And then, of course, freak accidents and, of course, suicide. So, again, trauma is very broad and it's very personalized to those of us that have experienced at least one or more of what I just mentioned. And so it's important that we know that we learn behaviors. Behaviors are learned, and it's usually can be based on traumatic experiences. So, right here early in life, and I won't read all of them, but as a result of trauma, we can see people that are harsh when provoked. Right? That's their
Right.
response. They're triggered, guarded in most social situations. They can expect betrayal in intimate relationships. Why? Based on a history of trauma in previous relationships. Sometimes they take on, I'm a victim. This happened to me, I'm a victim. And sometimes people get stuck in that victim mentality. Mistrustful of others. That's a huge one. Doubts
Mm,
information that's given to them. So again, these are just a few examples of learned behavior. And because behavior is learned, a pattern is built, right? We learn through repetition. So if you've grown up from a child and experienced any of what I just explained, it's non conscious whenever you make a decision or you're aware because it's a pattern. So
mm,
even if we are in counseling to learn new information, we are still going to fall back to what we learned prior because it's already a habit, it's already ingrained in us. So the same way that we learn behavior, now the challenge in counseling is to create an alternative behavior that works better for you as you move forward, right? So it says it requires a great amount of attention and focus to build new patterns, and it becomes more difficult when we become distracted, dysregulated, or we fail to maintain focus and attention. And so dysregulation is a big deal, right? And so what that means in our world is you become anxious, you become fearful, you become fight or flight, the trauma, you're triggered. And so now internally and then externally, you're acting out because it's the fight or flight, right? It's the fear response that we have because now we're remembering, we feel very similar to what we felt in the past. Does that make sense? Feel free to interrupt me if you want.
Yeah, no, it does actually, because you're
Yeah,
going off of your past experiences. So something,
right.
how something has happened in the past, and also how you have had to deal with it. If you have seen, your parents in an abusive relationship is abusive. You kind of maybe follow what you have seen because it's the trauma that you saw as a child, and you kind of like, this is what I know, kind of thing. And that's how I'm seeing
Exactly.
it. So as far as
Very right.
in that aspect, and give us a little. Those are traumas that are because something has happened, right? Is it
Right.
always is it always something that is something that's triggered? Like, for instance, talking about people that have disorders, and you may be talking about that later on, but like, as far as like the mental disorders or something like that, or bipolar or whatever, are those things usually come up like because of something that has happened, or is it something that's genetic? And I know you're probably going to speak on that, but is it something genetic that is in your system that genetically you have a trait of, or is that something that kind of happens because there's a triggered trauma that's happened in your life?
Okay, so great question. So we all know the nature versus nurture discussion or dispute or debate, right? And so, according to evidence-based research, there are four mental health diagnoses that we say couldn't have a genetic link, organic, that you're predisposed, which just basically means you have a higher probability than someone that's not predisposed to have this disorder potentially if you face situations like trauma that send you into some sort of response or reaction. So those four would be ADHD, which is attention deficit hyperactivity disorder. They say there's a genetic link with that. Schizophrenia. That is a severe and a profound mental health condition. They say there is a genetic predisposition to that. Depression. Okay, we know depression is sadness and being low and whatnot. And now what is the fourth one, Nairi? Bipolar. So
Mhm.
bipolar is a mood disorder and it's combined with highs and lows. So you have your low, which is depression, which is already linked, and then you
Mhm.
have your high, which is mania, the impulsivity, the high risk
Yeah.
behavior. I feel like I'm on cloud nine. I'm grandiose, I can't be touched. I'm invincible. And so bipolar is like a mood disorder. You have your highs, you have your lows. So the whole point of understanding that is as you go through life, if you face one of these distractions, one of these traumatic events, and you don't address it properly, it can then sit in you and then manifest itself and create mental health challenges. Right. And that is why it's important to not only know your family's history, but also be aware of what triggers you. What are your triggers? Triggers basically mean something that reminds you of an incident that happened in the past. And when that situation comes up in your present, you become dysregulated. How do we address triggers? We have to learn coping skills. We have to learn relaxation skills. There are all kinds of therapy, and specifically for trauma, there are several that have been, again, evidence based therapies, therapeutic modalities that work specifically for our trauma population.
Okay. Yeah, that and what are like, are there techniques and how to, I guess, deal with some of these? as far as how to manage it?
Sure. So as you can see, I put the Hulk on the screen and it says change and growth cannot happen if the environment is constantly or repeatedly activating the Hulk system. So
Mhm.
our goal with working with clients is to increase their stability. So we want to see Bruce Banner, right? The nice guy brain
Yeah.
versus the Hulk. So once someone becomes activated, now you're talking about what does it look like in terms of medication management and or therapy. So there are several. One of the first ones for individuals that have experienced trauma is what we call DBT. We use a lot of acronyms in this field. And so DBT is dialectical behavioral therapy. And one thing that that does is help you with emotional regulation. So again, background information. A lot of people say, oh, that happened. You can just get over it. What's the big deal? What happens is our nervous system, central nervous system, we have something called the vagal or the vagus nerve, our autonomic nervous system, our brain, all of that is connected and we are wired to have that connection with our emotions. When we have a trauma, a traumatic brain injury, an injury, the link is broken. And that's
Mm.
what causes us to turn into the Hulk. We're activated. So it's broken. And now it's a matter of how do we get it to come back together? We can't grow cartilage when we tear our cartilage. We cannot grow a new brain. So
Right.
what we have to do is try to work with telling our brain, healing our brain so that our brain and our nervous system, everything comes back together to calm down so we can behave correctly. So oftentimes people go to therapy, oh, you're misbehaving, you're acting out, you're doing this, but we've never said to them, you are behaving appropriately for what happened to you.
Mm.
Okay. So
That's
I'll
kind
just give an
of,
example. I had a client, severe post-traumatic stress disorder, a victim of severe domestic violence, but she also had OCD. OCD is about, order and being clean and all these different things. Well, as a result of what happened to her, she was afraid and fearful to go to the restroom. So she kept mason jars in her room and she urinated in those jars. So
wow.
she was embarrassed and she was ashamed to tell me because she's like, how do I have, this disorder of, compulsion and I'm obsessed with being clean and having order, but yet I'm doing this thing, hygienically that doesn't really fit. And so I had to, alleviate that shame for her. And I said, actually, that is an appropriate response to the trauma that you have experienced. So I had to normalize that for her. And we had to work on helping her to feel safe. So when you're
Mhm.
unsafe, DBT focuses on emotional regulation. It talks about distress tolerance. It kind of helps you to be aware that these two things can happen that may appear to be opposing. If you are accepting of them and you release the shame and the guilt from it, you can actually live with the two in a healthy way and move forward. And again, removing the shame and the guilt on how you feel about yourself. So DBT is one. We have mindfulness and grounding, and that's all about being present, right? Because remember, I
Mhm.
said trigger, oh snap, it reminds me of something to pass.
So
I'm about to
from
flip the
that,
table, right?
right,
So
right.
mindfulness is about using, and grounding is about being present right now in this moment, using my five senses. What can I hear, taste, smell, touch? Um,
Mhm.
and hear, taste, smell, touch, my old seasoned brain. Feel, touch, taste, smell, see right now
Mhm.
in this moment because the goal is I'm safe. Right. So
Mhm.
there's people that are in my personal life as well as myself. The first thing when you start to feel that, am I safe? Am I safe? Okay.
Right.
So if things happen to you as a child, little girl or boy, now you're an adult and our goal is to empower you. So if you're not safe, you know what to do, right? No, I'm not sure what to do. Well, who do you call when you're not safe? Who can come in? 911? Exactly. So you know who to call now. The little girl didn't know what to do, but the big girl today knows that when she doesn't feel safe, she can call 911. So they're like, oh, yeah, that's right. But are you safe? Yeah, I'm safe. What can you see? So it brings you present
Mhm.
because we're trying to avoid you going back. Because if you go back there, you're going to have what? The response in the Hulk.
Right.
But I'm trying to get you to be Bruce. So mindfulness and grounding is about that relaxation, stress reduction, calming, self-soothing. One of the best in the whole wide world things to do is learn how to breathe correctly. Okay, people think that breathing is not so much of a big deal. It actually is. And if you proactively breathe every single day when a trauma or a traumatic event or trigger happens, instead of you going sky high, you may rise a little bit above, but then you're able to bring yourself down. Why? Because you're creating a new habit. Your new pattern is to learn how to breathe. So you inhale through your nose, you hold it, and then you exhale through your mouth. And
Yeah.
they say it's actually good to make that noise, right? And then with this, DBT and trauma, bilateral stimulation is good. So then you teach the client how to do this while they breathe. And if they feel like it's weird doing this, then above their thighs, they can do the same thing and while they breathe, because what that does is it's helping to deactivate the activation. So it takes time based on the level of the trauma, because remember, it's individualized. So, based on the level of the trauma, who the individual is, how often you do this new thing, that is how long it takes for you to change and have this new healthy behavior. EMDR, eye movement desensitization and reprocessing, is a game changer, because what it does is it allows you to go back to that traumatic event and you have to relive it. But before we can even do that, we have to know that you can use your mindfulness and your grounding and bring yourself back to balance, regulation, and homeostasis before we take you back there. So for me, when I'm working with a client and I'm like, okay, we're going to, first of all, we have to build a rapport. I can't just say, hey,
Right.
Christy, tell me about your worst experiences. No, we got to get to know each other, right? Every
Right.
therapist, and as a clinical supervisor, the hat that I wear, I say every therapist, every great therapist has a therapist. So I always let my clients
Right.
know in transparency, I go to therapy. I have a therapist and I choose wisely. Why? Because it's a service that I'm paying for. So I'm going to read the bio and I'm going to make sure that your strengths align with my needs. Right? Because my
Right.
relational trauma is not light. I'm going to need a heavy hitter. So I have to read and make sure, because when I go in those scenarios, I let them know, hey, I'm a therapist too. I'm a counselor. So I need you to give me, the nuts and bolts and come at me in a way that is going to be helpful. So one of the things I do with my clients is say, okay, we're ready to kind of go back to your timeline and talk about these things. But if I see you physically getting, aroused and you're not breathing correctly, we're going to agree that I go like this. And when I go like this, that means we got to center. We got to center, and we're going to take a minute and we're going to breathe, both of us, and we're going to bring it down, because I'm hearing what's happened to you. So I also have to make sure that I'm in Bruce Banner at all times. Okay,
You're
so
right.
those are just a
Right.
few of the modalities. Mind you, there's a lot more, but per research, these are the ones that work most effectively with individuals that have experienced significant trauma.
The relating it to Bruce Banner and Hulk, like when I saw this picture in the slide, I was like, that's powerful. That is exactly how I see trauma in certain situations, or PTSD happen. And I find it's funny how the mind works and how we go back. And I say that because I have a neighbor who has PTSD, and you can hear him, like, I'm guessing he was a veteran, because from what I understand he was a veteran. And so some of his PTSD is from being in the army or whatever. And I can hear him yell, and we can, I mean, we all can hear, right? um but I see him walk to the store, and he goes to the grocery store, and I've seen him there. He'll get his food, whatever, and then he's back here, and then it's total chaos at home. But I'm always kind of curious of how is it that you know how to be so right mind, and walk to the store, get what you need, and then when you get home you're out of it, like you're completely, and we can hear you screaming, you leave your door open, like everything. And it's funny how the mind works. But when you say Bruce Banner and the Hulk, that's how I
Right.
see him.
So it's interesting you would say that. And you and I met through your best friend, and we have a lot in common, and that's why she wanted us to meet. So my father is a veteran. He is now deceased, but it's Vietnam War. How many years
Mm.
ago was that, right? you can't unsee that. You know, now we have this little running
Mhm,
joke, like you see something you're like, oh my gosh, I cannot unsee that. Well,
mhm,
our veterans, they cannot unsee that. And war follows, falls under PTSD. So PTSD, post-traumatic stress disorder. It's different than trauma because first of all, not everyone that has trauma meets the criteria for PTSD.
mm,
In
okay,
our world, we have the Bible for mental health is called the DSM. And right now we're on version 5 because again, it's always changing. We got to go with what the people need, right? And so,
mhm,
diagnostic and statistical manual version 5. And so, individuals, before you can just be diagnosed, you have to meet a criteria. So, a lot of individuals with PTSD, we can say that they had a hands-on offense, right? So, for example, if you witness something, that's not a hands-on. But if you were beat, domestic violence, if you were raped, any form of assault, if you were in war, if you were shot, those are more interpersonal things.
mhm,
PTSD generally shows up within the first 3 months after that traumatic experience. They have flashbacks, they have nightmares, vivid images, intrusive thoughts, there's paranoia, there's some disassociation. Right? Because when things are too painful, you might hear some people saying, I just go numb. Me personally, like if it gets too heavy and crazy with loss and grief, I just get to a place where I can't feel, right? Just
mhm,
like I can't feel. So disassociation is beyond that. It's almost like creating an alternative reality because your reality is so intense and it is so painful, you can't be there. And so when we think about individuals with depression or bipolar or with PTSD, we have to be careful about the judgment of their lives and their experiences because if
mhm.
you can imagine feeling like a hostage and being that situation, nobody wants to live in that pain,
Right,
right? So it's a matter of educating people that most things, because I stay away from absolute, most things in life are temporary. The intensity, the frequency, and the duration of that thing should not be at an all-time high at all times if you're getting the services in place,
mm,
right?
right,
Individuals who can't seem to get regulated and stay in the place of dysregulation, they want the pain to stop. And
right,
because you said the mind is tricky, and because I told you the emotions and the brain, the mind, because of this trauma, the link is snipped.
yeah,
If I'm in that space, the only alternative is to leave, is to exit, right?
yeah,
So when you're in your correct frame of mind for all intents and purposes, that is not your only option. When you are in this place and you are in the Hulk day in, day out, and you cannot navigate around that, that becomes an option.
okay, yeah,
Okay, so
yeah, and I
post-traumatic
can
stress. So what
yeah,
has happened is potentially he went to the store, he was cool, he went in there, he may have heard a sound, he got them groceries, he came home, he responded. He's reacting. Now he's reacting. Now he in war. And it's interesting. I brought up my dad because there were times that he would hear a noise and he'd try to, come on, we got to get under this bed. I'm like, what in the world? Come on, they trying to follow us. There were
yeah,
times he wouldn't be clean cut because he was in disguise, because he
mhm,
was like, yeah, they trying to come and kill me. And I'm like, well, who is they? He's in Vietnam. You
mhm,
understand? So they can't
right,
unsee it. They can't unfeel it. They can't detach from it. But then they also become very protective of it. If this is all I know, pattern, I don't know the unknown. And since I know this, I'm comfortable with this. So as distressing as it is, I'm going to control it. You're not going to take it away from me. So, again, as a clinician, it is my role and my responsibility to present to them a better option, to help them feel empowered, to help them feel like they have choices, to gain their trust. Right. So,
yeah,
when we come in acting all super judgy, like la la la, that's a turnoff.
yeah,
So, how am I going to be effective for you if I'm way back here, like you doing them? That's too much. That's a turnoff. And so, we have to do a better job with our approach. And through the years, some of these modalities that I mentioned for you have risen above the usual CBT because we have to meet the client where he or she is. We have to be effective, and that
right,
takes time. Trauma is not something that you la 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 see you. No, you can be in services long term because that's a lot to unpack, and we have to carefully unpack it. Because guess what? As we're going back, life is still lifing.
right,
Life is
right,
still lifing. New
right,
things are happening. So we going back here, but right now today, this new thing has happened that has spiraled me. So it's a very delicate, sensitive area. And I decided to do the trauma piece because, like I said, I was doing the loss and grief. I've done the crisis intervention and prevention. So it just made sense, personally and professionally. Like, I got to go deeper in this thing. What is this? And quite honestly, my reaction, my response to it, I love psychology, right? The study of behavior. It made sense to me that we've been doing things not as well as we should. And so
Right.
hopefully clinicians will get on board and do a better job so that we can help people more effectively.
Right. And the other part is, and now I don't know if he takes medication, and he may or he may not know, or he's able or stable to take medication. Is
Hmm.
that something that, having PTSD, do are they usually diagnosed with taking, or is it something case by case that you would prescribe medication to someone that has it? Because, like, I've seen him walk to the store. Like I said, he'll walk to the store, whatever. But I've also seen him take his cane as if he's in war right then and there. And I
Right,
know that something has triggered him on his way there to
right,
the store.
right. So, medication. So, let's be reminded that it's individualized. Mental health, what you want to do, what you don't want to do. Medication helps with the brain, right? Because it's organic. We have hormones, we have all these different systems going on. So, an individual with PTSD may have trouble, obviously, sleeping, right? Because your mind is racing you up, you're paranoid. So, there's medication they can take for that. They may have anxiety, right? You jittery, you think somebody's coming after you. Again, same thing that would be caused by paranoia. So, the answer is yes. There are cocktails that an individual can sit down with a psychiatrist, go over, make sure that yes, you meet the criteria for PTSD. But I always tell my clients it's not just medication alone. That does one thing, but counseling
Mhm.
covers the behavioral component. How do I change? Now that my brain is coming to a place of Bruce Banner and I can hear you and I understand the words that are coming out of your mouth, now let's get some therapy in with it. If we just do the medication, that will help to bring you regulated, but then what are your new behaviors to help you kind of stay
Mm.
there? So medication again is a personal choice. Medication, people need to be educated appropriately because of the mental health stigma, right?
Right,
Oftentimes, you find that individuals with various diagnoses, they start to take the medication, they feel better, and they're like, I'm cool, no more meds. Not
right,
connecting that I feel better because I'm taking the medication.
right,
Right? And so, and a diagnosis such as schizophrenia, they may be better served with an injection. Why? Because the injection can last for 30 days. So I don't have to think about popping a pill every day. I'm cool, but I still have to have a support system and be reminded that in
mhm,
30 days it's time for me to go back. But depending on what happens, because remember, life keeps on lifing, I may decide I'm not going back. So now the regulation that I've had for 30 days and I feel good and I think I'm great, now I'm going back and little by little I'm getting reactivated and now I'm back in crisis in the hope mode. So it's cyclic. It's like a cycle.
right,
Cyclic, whatever, right? So it's very important, again, if we have a great rapport with our clients and we're educating them and we're walking this out with them and helping them hand in hand and we're working as a multidisciplinary team, if everybody does their work and if the individual feels like I'm empowered, I have choices, I can make change, this is a better life, they will be more on board with all of these things. Right. But it's overwhelming. And I often say we have to remember no one asks to have mental health issues. They don't ask to have this. So again, our compassion, showing up, being real, us demonstrating consistency. If they ask for resources, do the resources. Continuity of care. Every Tuesday at 6 p.m., I need to see you. I better show up, right? So
mhm,
that's part of the trust. That's part of them regaining and
right,
rebuilding what it is. But unfortunately, we have burnout in this field. We have high turnover. We have a lot of different things. Our lives. So sometimes we have to take breaks. So it makes for a lot of changes that can set someone into a place of regression. So it's tricky. So yeah, he could be on medication, he could not. It just depends on his personal preference. Medication does help in a lot of instances. And I think what happens is if it doesn't work fast enough, or if it gives me a side effect that I don't like, or if I hear somebody in my ear talking about, you don't need medication, go and smoke you some marijuana, whatever, I'm not gonna go back and advocate every 30 days and say, "Hey, I was taking that, but I'm not sure it was good. Maybe I need a
Right,
little bit more." There's so many medications we have to go back and feel empowered enough to say, "Hey, this is working, this is not working. It is working, but I need a little bit more." And so having to do that and holding yourself accountable to do that can get, you know, it can get discouraging. It can get overwhelming. It can feel like, why me? Woe is me. And so that's why the therapy with the medication goes hand in hand, because we can have that dialogue about how you're feeling. Why do you feel this way? What can we do to make things feel better for you?
right.
CBT, the other form of therapy, another modality, is cognitive behavioral therapy, is changing the thoughts in your mind. So if I
Mhm.
can get you to change your perspective and shift the negative connotations and reframe them into something positive, then that should help you feel better. If you feel better, then you will behave better. And so that's every day. This is a choice. If
Yeah,
I think better, I feel better. If I feel better, I'm gonna behave better. And so it's just every day, that kind of thing. And so that's overwhelming. It gets tired. Sometimes we don't want to do all that. That's where the coping skills come in play, relaxation, the breathing, all of these things kind of all work hand in hand for, you know, helping an individual to attain the best version of him or herself, being invested in their life. Because it don't matter what I'm saying. Oh, you're doing great. If you don't believe it, it doesn't matter. So
right,
my
right,
goal is to help you to believe it and to see it, even if I see it. It's not what I want for you or what I see for you. It's what you believe about you.
right. And I know you mentioned really briefly about a therapist having a therapist, which is something I really love you saying that, because sometimes you wonder, do therapists actually go to therapists? And you have so much that you have to deal with, taking in everything that your clients are saying to you and then trying to help them. How does that weigh on you? And I heard you recommend it, but that is like, that's powerful to even say
Right.
that, because a lot of people that are therapists probably don't do therapy.
Right. So yep, if I had to qualify or quantify it, I would agree with you. It's just something that makes sense to me. It goes back to, how am I going to be the healer? How am I going to, you know, tell a person to do something that either I haven't done or that I don't even think that they can do? So for me, it makes sense to
Mhm.
go. I am no different. I like to be transparent, and I like to be authentic, and I like to be real, and I've had a lot of different experiences that requires me to have someone outside of me to talk to me about, right? In our field, ethically, we are not supposed to, counsel friends and family, and vice versa. So one of the top things I will say is my faith goes in with me. I don't believe this to just be a job, it's a calling. Because if I had it my
Mhm.
way, I would have been a pediatrician. But every time I tried to come out this field, God placed me back in. So once my client gives me the notion that they have a personal connection with a spirit outside of themselves, then we go in there. We go in there. So I stay, prayed up, if you will. Sometimes I have to isolate because by nature I am an introvert. I can't deal with all that stimulation. And if I become too overstimulated, then it's going to show out in my behavior, because I'm not
Mhm.
going to be thinking as clearly as I can. I'm not going to feel that great. And then I'm not going to behave that great. So being in tune with your own self, there are times when I was going through different things in my life, such as a divorce, where I would not counsel anyone, because in our field, there's something called transference and countertransference, where something going on with you, I'm over here melting down, or I'm in a session talking about me
Mhm.
and you came for you. So we have to be very aware of those things. So
Right.
before it even gets, crisscross and tangled, I have pulled myself out. Like, I can't. I will give you a most recent example. Last year, my father's, who is deceased, his birthday was December 23rd. Well, I thought I was going to have a session on December 23rd because I was cool. I've been regulated. I'm cool. December 23rd comes around. I was like, I don't really think so, not today. So I just text my client. I said, I apologize in advance, but today is my father's birthday, and I'm not really feeling my best, and I don't want to not be present for you. So if it's okay with you, can we reschedule the 24th to 20, whatever other day? And my client was good with it. Why? Because we have a rapport, we have a relationship. I set it
Yeah.
up in advance. I'm human too. I'm going to have good days and bad days. And so I'm open and honest, about those things because it does me no good to sit down to try to help someone when I'm working at a deficit. Zero good.
Right.
So I
And
must stay
yeah.
in a position of mental wellness to the best of my ability. I work out, I praise the Lord. I have a positive support system. I have colleagues, many that are in the field, so I bounce off things without disclosing, confidentiality. And yeah, I do the things. I have coping skills, I have breathing skills, I have relaxation, stress reduction. I have triggers. I have to be open and honest with the people that are near me and close to me that love me so that they're aware that if I have a trigger, there may be a behavior based on how quick I'm dysregulated that may not be characteristic of who I am when I'm regulated. So
Mhm.
we have to be clear that there's no cure for trauma. There's no cure for PTSD, but there are strategies and skills and interventions and tools that we can use to be the best versions of ourselves under the circumstances.
And I love that. And also to say that, it it's like the saying that I can't pour, into, like, I can't pour out into it if I'm, empty, and you can't give back to someone else if you're not, helping yourself. So
Mhm.
that makes a lot of sense. And talking about it is also thinking, has me thinking about when I first started, in fitness. I always said your body will go wherever your mind takes it. So it's one of those things that you have to help your mind in some type of way, just like a checkup. Like when you go to the
Yes.
doctor annually,
Mhm.
you have to get that mental checkup, whatever you're going through or whatever your traumas are, or whatever you find are your triggers. Those are some of the things. What would you say to someone or to others right now, like as far as like coping tools, self-care? You may not be able to go to a therapist, or you may not be able to do some of the things that financially maybe you don't have the insurance, or something of that nature. What would you tell people that are dealing with some, like, a trauma situation, or having, issues? What would be some of the things that you would tell them?
Excellent question. So depending on what state, we have the chat now, the crisis for texting, hashtag 988. In Georgia, we have the Georgia Crisis and Access line that's 24/7, 365, 1-800-715-4225. So there are free services available no matter where you go. There's peer support lines. They may not be licensed, but they can hear you, hear a situation and help you problem solve. In certain cities and states, there are free services, either free or for the under or uninsured. In Georgia, they're called CSBs, Community Service Boards. There's also CSUs, Crisis Stabilization Units. So I would just say definitely Google is a great resource. Free mental health services, Department of Children and Families, Adult Protective Services. So there's so many different things out there under the Department of Health and Human Services that people can definitely research and look forward to. Um, there are also therapists, clinicians like myself. Every now and again, I offer pro bono services.
Mhm.
It's like paying it forward. I never want to know of someone that's in distress, and I don't take a 30 minutes or 45 minutes, first of all, to make sure that you're safe. Crisis intervention and prevention is my thing. And so if you present as a danger to yourself or others, and you have access to ways that are going to hurt you, then I'm going to move forward by law and make sure that you are safe and that you are taken care of. And so those are just a few of the resources that I would say. Outside of that, YouTube and Google are free. You can go on YouTube and put anything in the search engine as far as you're saying relaxation. Yoga by Nidra is one that I often tell clients about. All you have to have is a phone or a laptop. You press play and you can hear her and she'll tell you how to relax your body, how to soothe your body. Research has shown, as you stated, physical fitness is everything because it
Oh,
releases the endorphins. There's something about that. And so I know personally for my anxiety and for my panic, you will find me at the gym a lot, and that's the place that I learned how
yeah,
to breathe. There is something about breathing. I think I posted it today that breathing is the one thing that helps to regulate all of your systems. And if you learn how to properly breathe, it can actually save your life. So there are definitely things that you can do to cope and to relax. Boundaries. You have to, first of all, you have to tell your truth. I often tell clients, it's great what we talk about here for this 45 minutes or 60 minutes, but I'm more interested in what happens when you're away from here. It's like faith. We can say we have faith all day, but until you are put in a situation in which you have to exercise your faith, you don't really know. And then you can learn and grow from those experiences and say, ooh, I got a little more work to do over here. Ooh, I got a little more work to do over there. So there are a plethora of free resources everywhere. I don't have IG, but you can pull up IG, you can pull up TikTok. I go on Facebook for the connections, but also for some of the memes and some of the reels. And I forward these to my clients, right? Because I'm all about wellness. I'm all about everyone, including myself, being the best version of themselves. We are all here on assignment, and some of us know what it is, and some of us don't know what it is. But when you know what that thing is, then you have to trailblaze at it. You got to go for it. And so that is what I would say to someone that doesn't have it. Connect with someone, because when each one, somebody can pay it forward. Somebody knows somebody in this network. And once we relax and we, erase the mental health shame and all these stigmas and keep it real, more people will be more willing and able to say, you know what, yeah, I need help. That's going on with me. I've
yeah.
experienced that too.
Thank you. Well, we are at almost at our time, but before I go, I want to say thank you so much for coming on and talking to us today about trauma and PTSD. And before we go, is there anything that you would like to share? And is it ways to contact you or anything of that nature?
Anything that I want to share, I would say, um, again, I think that it's important that we try to be more proactive when we reach out. I love, again, behind the smiles, because often we have been taught, right, to wear these masks and to be strong. My mantra in therapy is, I don't want you to be strong, I want you to be real. Some of these stories, some of my own experiences are heartbreaking. So I cry about it. It's no sense in keeping it in, because keeping it in is either going to cause you to be
Yeah,
medically unwell, diabetes, high blood pressure, all of these different things, insomnia, and holding it to the point where you can't hold it anymore is going to cause it to come out in a very drastic, inappropriate, toxic way. So
right.
there is a middle ground to it. There is a middle ground. We can learn how to strengthen our emotional muscle. We can learn how to drop pride and ask for help. And we can learn as a community, as a society, to stop judging. Because the last
Absolutely.
thing that any of us want is on the news to hear, oh, he or she looked different or funny. So when it drops in your spirit, whichever way that works for who you are, reach out to that person. Have people that you can go to that you feel comfortable with, that won't judge you. Heck, I reached out to you, I believe it was last Wednesday or Thursday, because I was having a rough day, and I was
Yeah,
able to express that, and you were there to simply listen. And I think sometimes we don't know what to do. So we're like, I ain't going to. All you got to do is say, how
listen.
can I serve you?
Yeah,
I may not know what to do, but I can certainly listen.
absolutely. And
That
that's
goes a very
that's all
long
we
way.
want. That goes a long way.
A
That
long way.
goes a very long way. So,
Yes.
well, I know you're licensed in the state of Georgia, and I don't believe you're taking clients right now. but if someone wanted to reach out to you or anything, they can definitely send us an email. We can share it with you if they have any questions or anything.
Oh my gosh. Plug. I'm sorry. I'm
Yeah,
sorry. Plug.
yeah.
Yes. They can find me on Psychology Today. I work for Impact Therapy, South Side of Georgia, Clayton County represent. We are taking
Woo!
in new referrals. We have hybrid services. We have in-house services at the
Okay.
office. We have virtual services. And so, yes, we have different clinicians, male and female, with a plethora of experience and expertise. Impact Therapy in
Impact therapy.
Georgia.
Yeah, in
Plug,
Georgia.
Impact Therapy.
Impact
That's my
therapy in
boss, my
Georgia.
business. Yes.
Yes. Okay.
So that's how they can find us, and I will take referrals through Impact Therapy.
Okay.
Yes.
Thank you. Thank you.
Thank
Well, it
you.
was a pleasure. Thank you so much. We
Thank
definitely
you.
probably will discuss other things because mental health is becoming where it's not completely where we're talking about it and breaking the stigma because I think we still have some stigmas to break, but it seems to be new things that we can talk about and keep the conversation open so that we're all aware.
Yes. Yes. Thank you
Thank
so
you
very
so
much for
much.
your platform and your foundation. So God bless you. It was my pleasure.
All right. Have a good night,
All right.
everyone.
Bye.